Here we are going to discuss the right side of the heart, its structures, the blood flow, and conductivity. Deoxygenated blood enters the right atrium through the inferior vena cava, the superior vena cava, and the coronary sinus. While we're in the right atrium, we are able to see the pectinate muscles within the atrial wall, bordered by the cristae terminalis. The fossa ovalis is significant in infants in order to shunt blood away from the lungs and directly out to the body. As the blood leaves the right atrium into the right ventricle, we move through the atrioventricular valve. This valve includes an anterior, posterior, and septal cusp, which then connects to chordae tendineae and onto its corresponding papillary muscles. The anterior papillary muscle is then connected to the moderator band. This moderator band connects to the interventricular septum and plays a key role in conduction throughout the right ventricle. As the blood leaves the right ventricle into the pulmonary artery, we move through the pulmonary valve. This valve includes right, left, and anterior cusps. As the blood leaves the heart, it moves on to the lungs for oxygenation. Let's move on to conduction of the heart. The pacemaker and origin of this conduction is the SA node. The SA node sits between the superior vena cava and the cristae terminalis. The SA node sends conduction throughout the atrium onto the AV node, which sits within the wall between the right atrium and the right ventricle. The AV node then sends conduction onto the interventricular septum, which is known as the bundle of His. The bundle of His then separates into right and left bundles. Down at the apex, these bundles then split off further into subendocardial branches, which disperses this conduction further around the ventricles. In regards to heart sounds, the AV valve is best heard at the left sternal border at the fourth intercostal level, while the pulmonary valve is best heard at the left second intercostal space. Thank you.